This video demonstrates procedures used for patients who present to healthcare providers with suspected swine influenza. The procedures covered include initial isolation of the patient, wearing proper personal protective equipment for the caregiver, obtaining nasopharyngeal specimens for viral testing, and cleaning the room after the visit.
A screening questionnaire will be used to identify patients who may be infected with swine influenza. If the screening questionnaire is considered positive, that patient and anyone with them should immediately be given isolation masks and asked to sit in a segregated part of the waiting area. They should be taken to the exam room as soon as possible to minimize public exposure.
I'm going to demonstrate the equipment that should be used when examining a patient. Isolation gown, vinyl gloves, N95 mask, isolation mask, goggles. And this is a hand sanitizer. We're going to press the pump and rub the Purell on our hands till it dries. I'm going to put on my gown. Put the head through the hole, arms, and tie the back. Cup the respirator with your hand, put the elastic bands on, and do a final tightening by tightening the metal nose clip, pinching it to make sure that it's secure. I'm going to put on my goggles and my gloves, and then I'll examine the patient. The swab is flexible so that it can be inserted into the nasopharynx. The distance between the nose and the ear should be measured, and half that distance is the distance that you want to insert the swab. Before it's inserted, it's curved a bit, and then inserted through the nostril into the nasopharynx. Optimally, 2 swabs are collected, 1 from each side of the nose. The specimen should be rubbed over the 3 wells of the slide, and then the swab should be placed into the pink medium. Remember to have 2 patient identifiers on all labels.
Remove your gown by pulling the back over your head and turning it inside out. Take off your gloves and your goggles, handling them from the earpieces. Finally, take off your mask and make sure to wash your hands.
Clean any contaminated surfaces with the appropriate cleaners, which include Sanicloths and Virex. Use gloves when using the cleaners. Clean the surfaces completely.